Well, thank you so much for joining us today for our webinar with the Health and Human Services Agency. Today we have Pete Weldy joining us. He is the Regional Director for the Administration for Children and Families at the Health and Human Services. We also have Emily Williams. She will be the Regional Administration for the Substance Abuse and Mental Health Services Administration. So we're very excited to have both of them presenting today. And without further ado, we'll go ahead and get started with Pete.
Thank you, Monica. Let me share my screen real quick. All right, does that look all right? Great, awesome. Well, again, thank you for those that are joining, and just want to thank Congressman Correa for the invitation to talk to all of you, and Monica Garcia, thank you for organizing it and inviting us. Really appreciate you reaching out. Like Monica said, I'm Pete Weldy. I'm the Regional Administrator for the Administration for Children and Families, which is one of the kind of many alphabet soup agencies that are under the U.S. Department of Health and Human Services. We like to think of ourselves as kind of the human services side of the Health and Human Services Department, and I'll get into some details in a little bit. I'm actually joining you from Denver today. I usually live and work in San Francisco, but I'm at a conference, so it's good to all see some friends from Orange County online. So a little bit about ACF, just the history of it. It's kind of a ginormous organization with a lot of different programs in it. And it's actually relatively new among all the HHS agencies, including some of those other kind of more name brand agencies you're familiar with, like the FDA, the CDC, et cetera. ACF was actually fairly recently put together from kind of an amalgamation of different programs and thrown all in the same agency in 1991. So it's relatively new. What we do, like I said, we do human services. We promote the economic and social well-being of families, children, and individuals. And our vision and mission is really to make sure that children, youth, and families are resilient, safe, and economically secure. So here you see kind of the diversity of the programs we have, the sheer amount of funding. We're actually, among all the HHS agencies, the second largest by budget, with more than $62 billion and more than 60 different programs. Like I said, as you see in this kind of pie chart, that we have a bunch of different programs. Some of them you may have heard of, some others maybe not. The Temporary Assistance for Needy Families program, of course, TANF, is under our Office of Family Assistance, and it's the largest portion of our budget. We also have had Head Start, the Child Care and Development Block Grant, Foster Care, Adoption, Social Services Block Grant, Child Support Enforcement, the Low Income Heating Energy Assistance Program. So you'll see kind of all these different human services programs that we have. Real quick, just wanted to highlight something that I'm frankly kind of excited about. I don't normally get excited about strategic plans because usually what happens in my experience before I joined the federal government is you work so hard on developing a plan and then it kind of sits on a shelf. But this is not sitting on a shelf, which is really encouraging. The Biden administration has really made equity, racial equity and justice a huge priority of the administration, which is encouraging to me and to all of us. And so rather than having equity as kind of a separate thing, which never is productive to actually addressing equity, it's actually built into every one of our strategic goals. You'll see that's why it's an overarching goal. And it's just very encouraging. The goals 2, 3, and 4 are really about making sure that we're taking a primary prevention approach. So folks don't have to go and use our human services programs, but we're getting out in front. I'm actually like at a home visiting conference this week. So like home visiting is a great prevention approach, and we are exploring many, many others. And then our strategic goal number 4, which I'll highlight, and I'll get into that in a little bit, is really about emergency preparedness and response. You wouldn't think that the Administration for Children and Families would play that role, but we do. In the event of a disaster, we kind of deploy human services to support individuals that are affected. And then our 5th one is really internal facing. Of all these goals, I think this is the most interesting one because not only are we kind of extending out into the communities with some of these goals, but we're looking internally as well to promote internal innovation. We just had a competition among staff to propose new ideas, and we're running with a handful of those ideas and seeing what comes of them. So real quick too about our leadership, excitingly, we have a fully confirmed, Senate confirmed Assistant Secretary. ACF is a little weird because we have so many political appointees, and 3 of them require Senate confirmation, including our Assistant Secretary. But I've had the pleasure of meeting her on several occasions now, and can say that she is just really focused on community. She comes from a legal aid clinic in Arizona, worked in the Department of Homeland Security for a while, worked in the Health and Services Agency in Arizona. So she really has an eye and ear for government, but also understands the impact that the decisions we make have on families. And you'll see all the other program offices that are within ACF. Some of them you probably have heard of before, right? Like the Office of Refugee Resettlement is one of our offices. That's a very famous one. Our Office of Childcare. We also have kind of lesser known ones, like the Office of Human Services Emergency Preparedness and Response, or SEPR is what we call it. And the Administration for Native Americans also, that focuses a lot on language, on Native language continuation and development. Children's Bureau, you name it. I won't name all of them, but you'll see all the alphabet soup. We've got a lot. Real quick about our regional structure too. The thing that when I first joined the federal government, I thought that I was going to have to move to DC, but little did I know that DC is not the only place where the federal government lives. And the regional offices are really structured so that there is a local representative. You don't have to go to DC to talk to the federal government. You can stay local. So like I said, I normally live and work in San Francisco, which is the headquarters for Region 9. So you see of all the 10 regions, Region 9 is the best region because it is so diverse, ethnically, religiously, urban, rural, you name it, we got it. So we're California, Arizona, Nevada, Hawaii, and the Pacific territories and freely associated states. So many of you are probably familiar with territories, but we also have independent countries that have compacts of free association with the US government. And those include Palau, the Marshall Islands, and Micronesia. So we work with all of them on various programs and funding that they receive from ACF. So quick about me in particular, about my job and my role, and how I can be of assistance potentially to the folks that are on this webinar. Is I'm actually housed under what we call the Office of Regional Operations. So I serve as the ranking official for the Administration for Children and Families in that big region. But we do a lot of things that are not necessarily programmatic. I'm not implementing a program, but rather I like to think of us as the connective tissue in between programs. So we frequently work with our state human services agencies. So the California Department of Social Services are our primary point of contact. I was really pleased last week to host all 4 state agencies in San Francisco, and we had a great discussion about challenges they're facing, sharing best practices and innovations between the 4 states, among all their human services leaders who usually report to their governors. We also do cross-cutting strategic initiatives. Some of those come directly from the White House, some come from the Office of the Secretary, so of course our friend Secretary Becerra, or our own Assistant Secretary. I also describe our work, you hear a lot about busting up silos, and trust me, like we need to bust up a lot of silos. But I also think that sometimes silos are operationally necessary just because of the way Congress has funded our programs. So our role at the Office of Regional Operations and my role as regional administrator is really to be the elevator, the connective tissue between all of our program offices, the connector between all of our staff. And we have in the region about 65 staff across ACF's various programs that are working directly with all of our states and grantees. We also do external and internal communications, and like I said, emergency preparedness and response. We're in charge of emergency repatriation. So famously, you will know about when the pandemic first hit, we had to evacuate American citizens from Wuhan, China. It was our region that responded to that crisis and to help repatriate those individuals after the COVID broke out in China. And then also we do the unsexy but very important work of supporting kind of the administration functions of our 65 regional staff. So I won't go through all of this either, but there's a huge benefit, I think, of having local partners. So you don't, like I said, have to go to DC to talk to somebody in the federal government. We're just up the road in San Francisco. And the one thing I think that we do is we're kind of like a circuit breaker of sorts, where we both listen to innovations, best practices, and challenges from our states, territories, and tribes, but also where we are able to share that up and hear about, White House priorities, and we can push it down, but we also push things up. We're kind of that connective tissue. So you may hear too the federal government talk about our central office, our regional office. It's kind of like a congressional office in some ways. You have a congressional district office, it's based in the district, and then there's the DC office. We're not any different. Our central office colleagues focus on national work. They work with national philanthropies, and promote national innovation. We do that same work, but on a regional level. And it's honestly, frankly, easier to do it on a regional level, which is where we really shine, I think, because then you can take the best practice that we've developed locally and then blow it up nationally. In terms of funding opportunities, which I know you're all interested in hearing about, like you've seen, ACF is a very large, complex organization with tens of billions of dollars in grants. We have many mandatory grant programs. So a nonprofit or community-based organization won't ever see that money come directly from the federal government. There are numerous intermediaries involved in that process, and those grantees are usually the states, tribes, and territory governments themselves. So when you're thinking about a mandatory program, you can think about basically anything under the Social Security Act. So child welfare, foster care, adoption, I'm trying to think of another one. There are a few mandatory programs that we have. So that's money goes straight to the governments. But we have quite a few discretionary programs as well, which usually are operated on a continuing resolution. Some of those, a good example of that is our Runaway and Homeless Youth Program, where it's a direct federal to grantee relationship where we fund nonprofits directly to support, help, and house youth who are homeless. So if you're interested in taking a look at some of our grant opportunities, I have my own qualms with grants.gov, but it is the best resource we have to go and find grant opportunities. You'll see some here. We took a screenshot recently. I invite you to go to grants.gov, put ACF in the keyword box, and just see what opportunities are out there. Like a good example, I think, is this diaper distribution demonstration and research pilot, which is coming out of our Office of Community Services. That grant window just closed, but that's a great opportunity for a nonprofit, a community or faith-based organization to take a look, see if you apply, and give it a shot to see if you could demonstrate locally about like a diaper distribution program. In terms of whether to apply or not, this is my last slide. Is whether you're eligible or not. That's a big thing. Frankly, we don't make it very easy to apply for grants in the federal government, but we're working on it. We're trying to get better. You'll see these things and you'll frequently hear them called NOFOs, or notices of funding opportunity. Those are the direct things that we release. And when you would go to grants.gov, that's what you would pull up. You'd see the NOFO and you'd be able to see all the rules that are laid out there, whether you could apply for a grant or not. Another resource, I said that was my last slide, I forgot about this one, but this is an important one, is the Partnership Center at HHS. This is not ACF, it's not SAMHSA, it's actually a separate kind of quasi-agency within HHS that really works with community and faith-based organizations. Really encourage you to go and look at all the resources that they have. And then finally, last but not least, I already introduced myself, but I'm Pete Weldy. This is my contact information. Please don't hesitate to reach out. We exist in the region to support you and your work. And if I don't know the answer, I certainly will be able to connect you with someone who does know the answer. I also want to acknowledge that our new intern, Haley Connor, is online as well, who will be helping us for the next few months. And I don't know if she had to get off, but Emily Hughes as well, who's our program specialist. I have 5 or 6 staff that work with me and support the work that we do in the region. That's a little bit about ACF. It's a lot. And if you find a grant that you're potentially interested in, but just get overwhelmed or confused, again, don't hesitate to reach out to me and we'll go from there. And I think that we'll probably take questions at the end, but I will now, I guess, hand it over to my dear friend and colleague, Captain Emily Williams from SAMSA.
Hey, thanks, Pete. That's actually, I learned something and you stole part of my thunder, so we're all good. I'm also going to share my screen with everybody, and so that you can kind of get idea of what we're doing here at SAMHSA. SAMHSA is also one of those HHS agencies that folks really tend to look for and have expectations that we're going to be able to do things, and we try. But like Pete said, sometimes the federal government moves very slowly and in a way that's a little bit painful, which is why you have our regional offices that are here to really support everything that you're doing. And I want to talk to you a little bit about the SAMHSA structure today, but I'm going to dive more into the grant application process, because having been a person who wrote grants in the past, when I was working with the Indian Health Service writing grants for tribes, I found that the SAMHSA grant application was really painful. And so if there's anything that I can do when you're like looking at this to say, hey, I need some help, I want you to know that you can reach out, because I, one, feel your pain, and two, I've been there before. So I think that we can kind of sort through some of it together. I want to tell you a little bit about SAMHSA, because I think it's really important for people to understand that we do have a mission, and that mission, the SAMHSA's mission, is really to reduce the impact of substance use and mental illness on America's communities. And I think if you can take anything else away from anything that I say, I want you to understand that behavioral health is essential to health. It's part of health. It's not separate from health. It's a piece of what you are. Prevention works. So if you're out there wanting to do some prevention work and write some prevention grants, reach out to me. We have an amazing prevention team at SAMHSA that's standing by ready to help you. Treatment is effective and people do recover. So you're not always going to have a mental illness or a substance use disorder just because you have one today. I think one of the things that's really important for people to understand is that, you know, as part of the Health and Human Services, SAMHSA's real overarching mission is to really provide grant funding opportunities and really support what you want to do in the states, the territories, as well as your tribes and local communities. So I'm assuming that most of you are like local communities or local organizations that are looking to do things, because the states have grant writers who probably know more than Pete and I combined when it comes to writing a grant. But we really want to work to provide that technical assistance to both the grantees and to people who are actually out there doing the work. So clinicians, practitioners, peer support specialists, people who really, really want to support the reality that behavioral health is a part of health. We do a lot of publishing of evidence-based practices, so we have the opportunity to really support you in clinical work that you're doing. And we share those resources, which is something that's rather nice. You know, prevention, harm reduction, treatment or recovery, those are things that are available at the SAMHSA website. And another thing that we do, which will help you in writing a grant, is that we really collect and analyze behavioral health data. So when you get ready to write your grant and you're like, gee, I don't know what I'm supposed to put in there, I need some statistics for my community, you can reach out to us and we'll support you and help you with that. And so we really try to, you know, really raise that awareness of what's available and how to help you to get it. These are some of our core principles, but I find this a very busy slide, so I'm going to jump to the next one because it kind of tells you about our priorities, which is really probably the most important to what we're talking about today. And if you look at the screen, the third one down there says financing. One of our real priorities and principles is to support through financial resources what you're working on in your communities, to really try to bring together equity and recovery and building of your workforce. With that, we have some transfer technology centers. So we have an addiction technology transfer network, a mental health technology transfer network, and a prevention technology transfer network, as well as probably, I think we counted up the other day, there was like 60 different either centers of excellence that are available to support the work that you're doing in your community, or community specific. We definitely, the Latino Mental Health Technology Transfer Center having a big conference in Las Vegas next week. So those are things that you can join to not only get training and potentially continuing education, but also to really gain connection to other people who are doing the same work so that you can learn from each other and share information and knowledge. And part of that network, those TTC networks, there's one in every region, just like Pete said about the 10 different regions. There is one in every region that we have right now, but I want you to really think about this. You don't have to just stay in region 9. So you don't have to just look at the TTC network in region 9. If there's something in region 8 or region 5 that you're looking on, you think, wow, that's really interesting, I'd like to participate in that training, you can sign up for that. Or if they have a particular resource on their website that you want, you can reach out to them and they will provide that to you. So it is not, even though the centers are regional specific and really try to focus on the needs of the communities that they're serving, sometimes there's a lot of cross-pollination that goes along with that. But what we came for to talk about today is grants and funding opportunities that we have. And I think that it's really important to understand that there's some grants that we can't do a lot about. Pete has those two. They're the block grants. So you have your state opioid response grant, block grant, you have your mental health block grant, and you have your prevention block grant. Those are not funding opportunities that individuals or small communities can apply for. But our discretionary grant programs are programs that we really want you to apply for. And we have them in prevention, we have them in mental health, substance abuse treatment. I was literally just at some offender reentry support groups that had been funded by some SAMHSA monies in Nashville, Tennessee a couple of weeks ago, and I was so impressed with what they're doing with veterans and really working to really make a smooth transition back into society so that people don't end up having to reoffend and begin that cycle over again, and starting treatment while you're incarcerated so that you can continue that treatment after you come out and re-enter into your community is just a huge benefit that is available to people. And these are some of the grants that you all can apply for because they're discretionary grants. So they're available to different groups and agencies. So one of the ways, also like Pete has, is we have their grants forecast, and we also have a list of the grants that for fiscal 2022, which they're all pretty much done now. But you can see that we have the grants forecast. So that's going to give you an idea of what's available or what we're looking to project for the next year. So for fiscal year 2023. But I say those grant announcements for 2022 because I think that if you look at those, you kind of get an idea of what's been awarded and what you could think maybe some ideas of things that you want to work on moving forward. So if you see something and you say, well, that was already put out last year, well, look at how long that grant is going to last, because that grant might only be a 1-year or a 2-year or a 3-year grant. And so you could get all of your ducks in a row and apply for the next grant cycle that comes out. So I really think it's important to look at what's already been awarded in the past so that you have an idea of what you want to sign up for in the future. Also, you can sign up to receive updates. And I'm pretty sure that Monica said that she can share out these slides with folks at the end, but you can sign up to get email announcements about what's coming up in the future. This is also the grants.gov. So instead of ACF, I want you to type in SAMHSA, and that will give you the opportunities that are coming out. Now, I will say that there's not much coming out right now because it's the end of the fiscal year, and the fiscal year will restart again in October. And so things should be coming up and really be available at that time. But look at what's forecasted so that you have an idea of what you might want to apply for. One of the things that you need to think about is the eligibility. So you need to really look and decide when you see these notice of funding opportunities if you're eligible to apply. Because some have limited eligibility. Maybe you have to be associated with a university, maybe it's a professional organization, or maybe it's a nonprofit hospital or an emergency department or a recovery community organization. So look to see what the eligibility is so that you don't put the time in it and effort into applying for something that only to be rejected at the end because you weren't actually eligible to apply for it. This is also something that's really important to remember, is those required activities. Whenever you apply for a grant and you are awarded a grant, you have to start providing the service delivery by the 4th month of your project. So when you're applying for a grant, you kind of have to put your ducks in a row before you really apply, because if it's a short opportunity and it comes out and then you're given the grant and you're not prepared with your director or with the people to begin providing those services, then it makes it difficult for you to really be successful. So how do you prepare? Preparation is the key. I tell you time and time again, preparation is the key. And because of that, SAMHSA has a tool. We have a grant application tool, because even as Pete mentioned, sometimes applying for a grant can be kind of painful. And to help lessen the pain and walk you through the application, you can literally download a grant training process for you to utilize in what you're doing locally. And it does help. It helps you to develop a really competitive grant application. So utilize the toolkits. Go explore around on the SAMHSA website, and it's samhsa.gov, and look through the publication section and you may find other things that are helpful. But I think this is probably one of the most helpful things that I've seen come out of the library recently, is that application writing and how to really make it a competitive process. And data. My background is social work. Data is not really my strong point, and that I'm a clinician. So I like data because it helps prove what I want. SAMHSA loves data. The federal government loves data. They want data on everything that you do. So when you're getting ready to really put your grant process together, look for what's going on in your community. Look at the substance use and mental health issues that are impacting your community. And if you don't have community available information, reach out to others' information, like maybe the state that's responsible, or visit the SAMHSA website. Or if you're like, I just don't know where to look for this, reach out to me and I'll reach out to CBISC, which is our statistics organization, and find out where to find the information for you. Look for those opportunities to gather information so that you can figure out what the gaps are of service in your community, and really have a team. One person can't apply for a grant. I've spent lots of years doing different grant writing things, but the very first grant that I went to, and I didn't apply for it, and it was a SAMHSA grant. It was a Native Connection SAMHSA grant. And I went to the technical assistance thing, and they said, have your teams sit at a table. So they had these big round tables of 8 in a hotel providing technical assistance. And every other table had at least 5 people. And I had a table of 1. I knew when I sat down that there was no chance I was going to be successful, because I didn't have a team of people, and my community leaders weren't there with me to really network and pull that panel together to make that grant work. Needless to say, we did not get that grant. So I always try to say that, make sure you really have a consortium of people. And if you can't do it in a small community, if you're in a small community and you don't have a big group, you're a community of 1 and you're wearing 5 different hats, reach out to other communities and get a consortium of people together to do the grant together and apply for it together. So how do you go about applying? There's a lot of requirements. It's painful. So you have to have a project narrative. You have to have a budget narrative. You have to have specific forms. You have to have attachments, job descriptions, resumes, letters of commitments, data collection instruments, consent forms, and documentation of your nonprofit status. That sounds like a lot, and it is, because it can be kind of painful. But there's folks out there willing to help you. So really, the first step before you do anything else is to get your Dun & Bradstreet number and really figure out how to use the SAMS registration and make sure that it's up to date. It has to be renewed every year. So if you applied for a grant 3 years ago and you haven't used it since then, it's not in there. So you need to make sure that it's up to date. You also need to understand how to use the ERA Commons. So develop a work plan. You know, what would you like to see? And this is all stuff that's available in that grants toolkit. Who's going to be served in your community by the grant? Is it going to be children, youth, young adults, elderly, re-entry folks? What do you want to see happen, and outline those goals and really make those goals so that they're measurable objectives so that you can say, I can do this by doing this. It helps. It makes your grant a much stronger grant. And then really look at the evaluation criteria on the grant application itself. Make sure that you're going to have impact. Make sure that it's relevant to what you want to do. Make sure that there's sustainability at the end of the grant program. You don't want to start a crisis line and then in 3 years have that crisis line go away because there's no sustainability for what you're trying to do. So those are things that are important to really, I think, really as priorities to look at. And then you need to really make sure that you have your statement of needs. Again, back to the data. The thing that as a social worker I'm not the most strong on is one of the things that SAMHSA and every other agency really looks at. Do you have current data? Is the data that you're looking at 15 years old, or is it recent? Those are things that are important, and really provide those citations within a separate attachment. Make sure that your goals are realistic and measurable. You know, again, you have guidance in the notice of funding opportunities, but they really have to align with the statement of work and make those objectives linked to a specific goal. And so you need to really look at that. And again, data collection, because one of the things that SAMHSA looks at for the success of a grant is whether you had smart, measurable, achievable, realistic, and timely goals and objectives in data collection. Delineate your response, or who's going to do what. You know, you need to know who's going to do what, when they're going to do it, how they're going to do it, and why they're going to do it. Those are important things that you really want to have addressed into your grant application so that you have your plan in place, your work plan, so that when you get awarded, you'll be able to flow right into within 4 months of starting into your program that you want to run. Have a timeline that's realistic. You know, if you're looking at something for 3 years or 5 years, try to have a realistic timeline. Even if it's vague, have some goals in mind, and keep it simple. Identify the staff, not the person. So it's the director will do this, not Emily will do this, because staff changes. You know, directors change, but the staff, the process stays the same. And really go back to that manual again and see what's available, see what's in there. There's so many resources that are there and ready to help you. Don't wait until the deadline day to submit your application. Make sure that if there's a glitch, maybe your internet crashes, maybe something didn't work right, or maybe there was a mistake, and somebody that reads it, when they see it on the other side, is going to send it back and say, this is incorrect. You'll have a little bit of time to address those submission errors that might happen. So there's resources out there. You just need to reach out to us to try to help them. This is one of them. You can look at other funded applications that have been successfully funded by submitting a FOIA request. So if you want to see what a successful grant application looks like, go to the grants.gov of things that have been in the last year and ask for a specific 2 to 3 funded applications from a previous year for a specific opportunity that you might be interested in doing. It'll give you a great template to look at what the components of a successful grant application would have in it. Other useful links, I'm not going to go through all these, but these, when they get shared out with you, they're how you really sign up to get the information that you need to support your grant application process and to support the work that you're all trying to do. And lastly, just like Pete, I'm here to help you. So this is my email information, and we're here to support you. And whatever way that we can to move things forward in your communities as the new funding opportunities are really going to start rolling out in the next year.